I am Dr. Raghuram. I am a pediatric hemato-oncologist at Aster Group of Hospitals, Bangalore. Today I am going to speak about a common disease called thalassemia. Thalassemia is a hemoglobin disorder where there is a genetic mutation and there is an abnormal hemoglobin which leads to breakdown of this red blood cells which carry oxygen around the body, and the children develop anemia. Children usually become symptomatic at around after the age of 6 months. They usually present when the child develops a fever or a cough and cold and becomes very pale, and when they are taken to the doctor, the doctor will do a blood test noticing the pallor, and the child is found to have severe anemia, and on examination the child may have an enlarged liver and spleen. And then they will get to do a blood test called hemoglobin electrophoresis, which will confirm the diagnosis. Most of these children with thalassemia major will need repeated blood transfusions, where they need blood transfusion every 3 to 4 weeks. And they need to get these blood transfusions lifelong. And it is very important to get NAT tested blood so that they do not get any infections because of the blood transfusions. Because of repeated blood transfusions, there will be an increased iron levels in the body, and this iron can get stored in organs like heart, liver, pancreas, and cause problems. So to reduce the amount of iron in the blood, after about 10 to 12 transfusions, they will be started on medication to reduce the iron levels, and they need to take these medications regularly lifelong. With this treatment, most of the children will lead on to have normal lives till about 30 to 40 years of life, but they will develop complications usually after this age. So the only curative treatment for this, which will get rid of the disease, is the bone marrow transplant. And this is usually done, we will get the best results when it is done from a matched brother or sister. And when there is no matched brother or sister, we can do the transplant from an unrelated matched donor, or from the parents who will be half match, called haploidentical transplantation. And post transplant, these children will lead on to have normal lives and will get rid of the disease and will not need any medications about 6 months to 1 year after the transplant. The bone marrow transplant can be done at Aster Group of Hospitals in Bangalore, and we have got a dedicated bone marrow transplant unit, and our team has done more than 250 transplants for thalassemia with very good results.